As the impact of the COVID-19 pandemic continues to subside and the U.S. will lift the public health emergency, health insurers can expect a more normal operating environment. Here to discuss what that will look like in 2023 as part of an AM Best annual review and preview report on the industry is Senior Director Sally Rosen and Doniella Pliss, Director. And Sally, health insurers' profits spiked during the pandemic years. Will that continue, or should we expect that to subside, and what will 2023 look like?
Sure. Earnings in 2021 and 2022 have been driven by government programs, basically Medicare Advantage and Medicaid managed care. And while the commercial segment has been challenged, the earnings are expected to be lower in 23, but we do expect insurers overall to remain profitable. Government programs, Medicare Advantage and Medicaid managed care, are typically lower margin business, which is the trend we expect to see going forward. Additionally, many insurers implemented rate increases in the commercial segment for 2023, which we think will improve profitability in that segment.
Daniela, a lower use of services during the pandemic was key. Have insurers seen pent-up demand in 2022, and what are the expectations for 2023?
Yes, there has been some pent-up demand, and utilization has reverted to pre-pandemic levels, with some areas even above pre-pandemic levels. But several large insurers with wide geographic exposures still saw non-COVID utilization at lower than expected levels. There's also been a shift in seasonality patterns of common illnesses, such as cold, flu, RSV, etc. And this likely was driven by return to normal and less mask wearing in 2022 compared to prior years. The industry also is seeing an increase in utilization and severity of outpatient claims. At this point, no one is sure if this is a temporary or more permanent shift. It is something that we're closely monitoring and discussing with our rated company. For 2023, however, there is still a possibility of higher severity claims due to missed or late diagnosis during COVID period.
There's been something of a shift to Medicaid and Medicare Advantage as well. Is that something we should expect to see to continue?
Government programs have been the primary source of enrollment growth for the industry. Medicaid enrollment will begin to decline as redetermination begins and membership starts to decline later in the year. So we do expect a lower share of revenues to come from Medicaid, which would shift the premium mix. Medicaid Advantage has been driven by the aging population, a trend which is not going to change. In addition, the share of Medicare eligible individuals choosing Medicaid Advantage over traditional Medicare has been continuously growing. This trend is expected to continue as well. With regards to earnings, we expect earnings to become more evenly distributed across three segments: Medicaid, Medicare Advantage, and commercial, as Medicaid enrollment declines and profitability declines as well, and insurers will focus on profitable growth in commercial segment.
Sally, the commercial segment seems to be headed in the wrong direction. What's driving that?
Profitability in the commercial segment has been negatively impacted over the past few years by several factors. There's been a greater number of COVID tests and corresponding office visits that was higher than expected and not fully included in pricing. And remember, during the period of the public health emergency, insurers have to pay 100% of the cost, regardless of where the claim is incurred, whether it's in-network or out-of-network. And the cost of a COVID test can vary greatly by location. An at-home test is less than $20. You go to a CVS or a Walgreens and it's a relatively low cost, whereas if you go to an urgent care facility, they administer the test, which could be several $700, plus they also may be charging for a doctor's visit, even if it's in network. The end of the public health emergency in May should help insurers, as COVID testing will then be subject to standard copays and out-of-pocket costs. The segment is also seeing returns to above normal utilization, as well as an increase in severity and intensity of outpatient utilization.
Sally, is COVID pretty much over and done with as far as insurers are concerned? And if so, what's the next challenge for health insurers?
COVID is moving towards an endemic phase. It will not be completely gone, but we're hopeful it will move to a flu-like claim. Plus, testing is more readily available. Individuals can test at home, and quarantine, which is a much lower cost claim. The providers are being pressured by staffing levels and higher costs, many of which are being passed on to insurers. And utilization patterns have shifted, with insurers seeing more and costlier outpatient care. overall increase in morbidity and the worsening of health conditions has yet to occur, but insurers are closely monitoring. As Doniella mentioned, earnings will become less concentrated by line, and insurers will likely begin to focus on the commercial segment for growth. Both growth and the ability to pass rate increases in the commercial segment might be challenged if there's a deterioration of economic conditions or even a recession.
Thank you, Sally. Doniella?
Thank you, John.
Thank you, John.
Senior Director Sally Rosen and Director Doniella Pliss, and I'm John Weber for IAM Best TV.